You know that kind of period pain that makes you stop everything you're doing, the kind that has you curled up in bed, canceling plans, canceling school, and still you're being told it's normal because period is supposed to hurt. But deep down, you know that this feels different. This is not just discomfort, and this is not just regular period cramps. You're not wrong, my dear. You're very right because I'm here to tell you that it could be endometriosis. And today we're talking about it in depthly so that we properly understand this condition because it's one of the misunderstood, underdiagnosed, and often ignored. Welcome to Mira's Health Hub. I'm Mira, and if this is your first time of seeing me, please don't make it your last by subscribing. And to my returning subscribers, thank you, thank you, thank you for choosing me. I love you all. I see you all. I know you all. And I'm happy you chose to support my channel. So to the topic of today, what exactly is endometriosis? Because I'm sure a lot of us has come across this word before. Okay, so for clarity purposes, endometriosis is a condition where the tissues similar to the innermost lining of the uterus called the endometrium starts growing outside of the uterus or the womb. This is the layer that sheds during menstruation from the uterus, but in this case, this layer is growing outside of the womb instead of being where it's supposed to be. It can grow on the ovaries, the fallopian tubes, on the outermost surface of the uterus, and even on the intestines or bladder. Now, here is where it gets pretty serious because every month, this tissue that grows outside of the uterus still behaves just like the inside of the uterus. It thickens, breaks down, and bleeds. But unlike your period blood, yeah, which has an escape route through the vaginal canal, this blood has nowhere to go. So it becomes trapped, and over time, it leads to inflammation, formation of scar tissues, and something we call adhesions, where organs begin to stick to each other, and that is where intense pain begins. Someone would ask me, but why does this happen? The exact cause of endometriosis is not still fully understood in medicine, but there are a few strong theories that backs the susceptibility of an individual to endometriosis occurrence. The first is something called retrograde menstruation. This is where instead of blood, your period blood flowing out, the blood flows backwards into the pelvic cavity, and this can cause inflammation and adhesions of internal organs. There's also the genetic component. If someone in your family has endometriosis, your risk of having it is high. And just like fibroids, yeah, hormones, especially estrogen, plays a major role in stimulating the endometrial tissues. To the symptoms, because this is where endometriosis really disrupts lives of girls and women, the most common symptom is severe menstrual pain. And I don't mean the type where you take a painkiller and go about your day. I'm talking of that pain that stops you in your tracks, pain that radiates to the back and legs, pain that makes normal daily activity feels impossible. There's also pain during intercourse, especially during deep penetrations. Some women also experience pain when using the loo, either urinating or defecating, especially during their periods. Some women also notice very heavy periods or irregular bleeding and chronic pelvic pain that doesn't wait for your period to start. One of the most heartbreaking parts is difficulty getting pregnant because, yes, endometriosis can affect fertility because the inflammation and scarring can block the fallopian tubes or affect the quality of eggs that is being produced monthly. But here is something important to understand. Having endometriosis does not mean you cannot have children. Many women with endometriosis still conceive, sometimes naturally and sometimes with medical support, carry their children to term and birth them healthy and hearty. For diagnosis, endometriosis is often delayed in diagnosis, sometimes for years because the symptoms are often mistaken for normal period pain. Imaging exams like ultrasounds can help, but it doesn't always detect endometriosis. The most definite way to diagnose it is through a procedure called laparoscopy, a minimally invasive procedure where a camera is passed into the pelvis to visualize the internal structures and surrounding tissues. Treatment depends on how severe the symptoms are and whether you're trying to get pregnant. Pain management is often one of the first forms of treatment that is being given to reduce the inflammation and discomfort you feel. Hormonal treatments can also help suppress the growth of endometrial tissues. Remember, I said estrogen plays a role. So the introduction of hormonal pills will help to regulate your endocrine system and stabilize your hormone production. Okay, but in more severe cases, surgery may be needed to remove the endometrial tissues and scar formations. In my books, pain in general is not something you should normalize, let alone severe pain. You should never normalize this. If your period is controlling your life to the extent where you're planning your schedule around your pain, if intimacy is painful, and if you're trying to conceive without success, please get evaluated, because your body is not exaggerating things, it's actually communicating. And the earlier endometriosis is identified, the better the chances of managing it effectively so that it doesn't alter your life or your activities of daily living. So the next time someone says, oh, manage it, is just a bad period, you now know better to go get it checked. Thanks for watching today's video. Subscribe to my channel and share with any girl or woman you love, and I'll see you in the next episode. Until then, love yourselves and treat you the best. Bye.